Hi Sam. Dr. Crescent asked me to meet with you today because of the mark that he found on your chest. Okay, you will be having that removed at your next appointment with him, but he also wanted us to go over how you can be a little bit more vigilant of your skin. Okay, so from now on, we will want you to complete a monthly self-exam. And I'm going to go over with you how to do that in a moment. But it is really important because skin cancer in particular, is really common. And if we catch it right away, then we can do something about it. But if you let it go when it looks strange, doesn't look right, without getting it checked, and it progresses, then you can really put yourself at risk, okay? So, how we're going to do this is, I know we have the spotlight on you today. Normally, when you're at home, you will want a bright light, good lighting, and a full-length mirror, also a hand mirror, and a pen and paper, or a body map, which I think the doctor gave you one of those, and so you can mark every mole on your body so you know exactly where it is, and if it changes, if it's new, if the color changes or anything like that. Also, if you have any lesions, anything like that, you want to note it so that we can check more regularly. Dr. Crescent will do a biopsy on the mark that we're going to be removing, and hopefully it is nothing to worry about. However, again, if it is, then from then on you have to be even more vigilant, because once you've had a cancerous mark, then there's an even greater chance of another one popping up, okay? So let's go ahead and get started. This is going to be a head-to-toe exam we're going to be doing on you. And we will just start with a check of the face, which is right where you're going to want to start at home. So you would want to check the lips particularly, tissue, and along your nose. Okay. And you will want to be checking this visually, and also checking with your fingers, okay? So nose, and then also check in the mouth, the tongue, and of course make sure you start off with clean hands. Okay. Right, everything looks alright there. Next, you would want to progress over to the ears. You want to make sure that you check the front and the back. Okay. And we have a term in medicine called palpation. That's just lightly touching as you go, so that you can feel for any bumps that aren't apparent to the eye. You go over to your next ear. Back, and it's really important that you keep an eye on this, because normally a dermatologist appointment is just going to be a quick once over. It's not going to be the whole thing. So you're the first line of defense for yourself in bringing up to him any changes or strange occurrences in the skin. Okay. So far up here, everything looks healthy and normal. Okay, so that's great. From there, we would want to progress down to your neck. Okay, and yep, just get in here. Alright, yeah, that looks good. Now, there are such things as skin tags, like I have on my neck right here. Okay, and those can be normal. You don't want to freak out every time you see well, it's just important to note it, and its size, its shape, if it's changing. But really important, especially now that he's seen one that was a little bit suspicious on you. So my tech in particular is checked, it's watched, and it's been the same since I was a kid. So moving on, we're going to continue, and from the neck we'll just go ahead and move down to your hands. Okay, can you give me a hand? Start with the right. Okay, and you're going to want to check the palms like that. Yeah. Yep. Perfect. And the back. You want to take a look between your fingers. And you also want to be really cognizant of how your nail beds look. A lot of problems can start there, and that's why it's so important to keep your nails and your hands clean and not let bacteria get under there. Okay, for infection reasons and just overall health. Alright, and your left. Thank you. So, the back, the palm, in between your fingers, and the nail beds. Okay. Next, we're going to move up the arms. Okay, and yeah, and you want to make sure that you're checking both sides, feeling and looking. Okay, and from there, we'll work our way, and this is really when you're going to want to use the full length mirror and check both sides of the biceps. Okay. Yep. Okay. Alright. So that looks good. And next, of course, we're going to move on to the chest area. The spot that is still there. Let me just take a look. Again, palpating and looking. And you want to make sure that you're also checking the breast tissue. It does not matter if you're male or female. It doesn't matter how much breast tissue you have, you still need to do a good check under the breast. Very good. Alright. And let me just take a look at this mark. Yeah, see, so the fact that it is a little bit irregular and it's a little bit dark, that is a sign that you would want to know. If anything like that pops up again, you need to let us know as soon as possible, okay? Okay. So, from there, we're going to go ahead and get a picture of your back. Now, I'm just going to lift up your shirt. Okay, that's good. And we're going to check your neck. We'll palpate here. Let's move your hair aside. Okay, and upper back. Again, full length mirror if you have a friend or significant other who can help. That's going to be even better, okay? And you'll continue down to your lower back. And when you're home, you're also going to want to do a check of the buttocks and the lower legs in the same manner. And I do see a couple, I do see a little mark right here. And that looks okay. The doctor said that was alright? Okay, then it should be okay for now, but again, you want to keep an eye, right? And if there is any further concern, you can always get it removed. It's not a problem. Alright, so that looks good. Just put your shirt back down here. And before we go down to the rest of the lower body, I'm just going to do a quick scalp check. Okay, so let me it's really good for the scalp check if you have a blow dryer on hand. Again, a friend or significant other will be good to get a really good look, but a blow dryer will help to really get in there. Alright, so let me go ahead and I'm going to check visually, but I'm also going to palpate through the hair into the scalp. All the way around the scalp, the base. Really want to take your time checking. Alright. And I know that a lot of people have dandruff or psoriasis or other skin conditions. That's not necessarily a problem, but if you do have any worries about that, the doctor can also tell you how to take care of that, okay? And it's pretty normal to have a little bit of oiliness or flaking. Right. So from there, what I'm going to have you do next is on the stool right here, just prop your right foot, and we're going to be checking the leg. So I'm going to start with the right thigh. Yeah. Palpating. Oh, I'm sorry about that. Didn't mean to tickle you. I'll try to be a little bit more gentle. And the calf. Checking visually and checking both sides. Both sides of the leg. Okay. Now, if you are diabetic, did you say you were? Okay. Your nerve endings can get a little worse over time, okay? And the feet is one of the most important checks that you can do if you have diabetes, because you may not realize that you have a problem going on down there, or really anywhere on the body, if you are diabetic, because of those weaker nerve endings. So you're going to want to check the top of the feet. And the bottom. And just like with the hands, you want to check between the toes. Yeah, separate a little bit. Okay. And the nail bed, the help of the nail bed. Okay. Alright, and just switch legs for me. Great, thank you. Okay, so the thigh and calf, okay. And your feet, tops, the heel, sole of the foot. Yep. Okay. A little better. Not as ticklish here. Okay, and between the toes and the nail beds. Okay. The other thing you're going to want to check at home, I know that it's something that you don't like to hear, but you are going to need to check your genital area with a hand mirror thoroughly. It's skin just like anywhere else, and it doesn't get as much fresh air a lot of times, so you want to really make sure that all of that gets checked too. Really thorough, okay? So that's pretty much how you go about doing the self-exam. Next, we're just going to go over the most important things in keeping your skin free of skin cancer as best you can. You do always want to hydrate really well with water, just to keep all your body running well. Okay, but the next important thing next to washing your hands and keeping them sanitized is going to be sunscreen. Now, with the sunscreen, a lot of people don't realize you can't just buy any sunscreen. Okay, it is good to have a separate one for the face unless it specifically indicates for the body. Otherwise, you may end up breaking out from that. So, the most important thing is you get a product that has UVA protection, which is the SPF that everyone talks about, but you also need protection from UVB, and that's called broad spectrum protection. And each sunscreen that you get, you really want it to have both. Okay. Now, Olay, you don't necessarily need an expensive brand, but what you should be paying for, whether it's cheap or high, is the amount of active ingredient in the product. Okay, so the cheap or expensive doesn't matter. It's just you want to have a generous amount of that active ingredient in there. So this is just one. And did you want to try a little bit? See how this one feels for sample? Sure. Okay, and before I do, I'm a big fan of sanitizing, especially when you're going in between limbs, so. Okay. And just close your eyes. And we'll just put that all over cheeks and forehead and down your nose. Okay, yep. Okay. Nice and cool. Perfect. Okay. The next is protecting your lips. Okay. So I have two that I like, and we should have some samples for you up at the front. Neutrogena usually is pretty good with its glycerin, and also fairly reliable brand that's not too expensive for you. This one is another one the doctor does recommend, and that is La Vanilla brand. It's more natural. You can understand the ingredients in it, so lip better. Did you want to try one of these? This one? Okay. Yeah, I really like this one. It's the one I actually use myself. Since we're doing your lips, let me use a Q-tip for that. Okay, just make sure you keep your mouth closed. Okay. Okay. Just. But yeah, it feels really nice. So there we go. All right, put that down. Obviously, for all over body, there's a lot out there that you can use. I like to save a little bit of time, and I do use an aerosol. Neutrogena, again, not expensive, but again, the most important part of a sunscreen is that it does not just cover SPF, which is UVA ray protection, but to have UVB protection, and that's called broad spectrum. Okay. You want to try a little bit of this on your wrist. Okay. It's also important that you like the scent and it's not too beachy. So, yeah, hold it. Your wrists, yeah, there you go. Yeah, cool. Yeah, rub that in for you. And I think we do have a sample, a little sample bottle up front too. So, I think, what are we gonna do next? For regular body lotion, moisturizing, and if you do have dry skin, again, La Vanilla is a really good one. Okay, and they have all kinds of different scents, and it's natural cocoa butter. So, smells really nice. I won't put it on you because I don't know if that's what you want to smell like. I guess you could always wash it off. Alright, I think that's mainly it. We talked about washing your hands being really important, sunscreen, hydrating, moisturizing, and Dr. Crescent has already gone over with you how to keep clear of acne and stuff like that. But you do want to make sure that you are exfoliating. If you can't afford a microdermabrasion procedure or product, a good one again every now and then, which is really good because it clears away the dead skin tissue really well. But you do want to exfoliate after you do a face wash from time to time, because the dead skin cells collect in there and that gets dirt trapped and bacteria. So just for overall health, you're going to want to make sure. And it doesn't need to be anything fancy. You can just take a clean wash cloth, okay? So to exfoliate, all you need is the right soap for your skin that Dr. Crescent can do for you, and then you just want to lightly, with washcloth in a circular motion, kind of wash away those dead skin cells, and not just on your face, but your entire body, okay? I think that completes the session. Did you have any other questions for me? Normally, I know it's a lot at first, but after the first time doing it, first couple times, it really should take no longer than 10 minutes for you to do the check. You just want to make sure it's really thorough. And, yeah, it may sting or hurt just a little bit, the procedure, but not for very long, and I promise you it's worth it. Much better than having further problems down the line, alright? So I hope you'll keep an eye on this. I'd rather see you here just for a regular check and healthy instead of any problems down the line. So I think we should be good. Thank you, and have a good rest of the day. And everything so far that I checked over today looks normal and healthy, but let's keep it that way. Alright, thanks. Thanks, Sam.